Today I will be doing my presentation on serotonin.
Serotonin is a compound present in blood platelets and serum that constricts the blood vessels and acts as a neurotransmitter. A neurotransmitter is a chemical substance that is released at the end of a nerve fiber by the arrival of a nerve impulse, and by diffusing across the synapse or junction causes the transfer of the impulse to another nerve fiber, a muscle fiber, or some other structure. Serotonin is created by the biochemical conversion process which combines tryptophan, a component of proteins, with tryptophan hydrolysis, a chemical reactor. Together they form 5-hydroxytryptamine, also referred to as serotonin. Homeostasis determines how far the parameter deviates from the equilibrium and feedback mechanisms to bring the parameter back to equilibrium. Feedback mechanisms maintain core body temperature around this elevated equilibrium. In the brain, after serotonin is released into the synapse, it is taken back into the neuron by serotonin transporter molecules, where it is broken down by the enzyme monoamine oxidase A. Autoreceptor activity causes a decrease in the firing of neurons and a reduction in synthesis, both of which tend to keep synaptic levels relatively stable. Most of the serotonin is stored in our gut because the enterostromophin cells produce large amounts of serotonin. Excess serotonin in the intestinal lining is harmful and can cause symptoms. Enterostromophin cells also release serotonin into the bloodstream, where most of it is taken up by platelets. The overflow of serotonin produced by enterostromophin cells is also released into the bloodstream. Blood plasma levels of serotonin are regulated by platelet cells through the serotonin transporter, which is expressed on the platelet cell membrane. In the image below, we can see that the regulation of blood clotting is an example of positive feedback. In a positive feedback system, the output enhances the original stimulus. Once a vessel is damaged, platelets start to cling to the injured site and release chemicals that attract more platelets. The platelets continue to pile up and release chemicals until the clot is formed. Most of the body's serotonin is found in the gastrointestinal tract, where it regulates bowel function and movements. It also plays a part in reducing the appetite while consuming a meal. Mood is most well known for its role in the brain, where it plays a major part in mood, anxiety, and happiness. Illicit mood-altering drugs such as ecstasy and LSD cause a massive raise in serotonin levels. Clotting is the third major role in the formation of blood clots. Serotonin is released by platelets when there is a wound and results in reduced blood flow and aids the formation of blood clots. Nausea. If you eat something that is toxic or irritating, more serotonin is produced in the gut. This increase in blood serotonin levels also causes nausea, but stimulating the nausea area in the brain. Bone density. Studies have shown that a persistent high level of serotonin in the bones can lead to an increase in osteoporosis. Sexual function. Low serotonin levels in the intoxicated state are thought to contribute to the associated increase in libido, while those taking medication that increase serotonin levels are seen to have a reduction in libido and sexual function. Some symptoms of someone with high serotonin may include agitation. Some people experience an increase in inner restlessness or feel agitated when serotonin levels become too high. This may seem counterintuitive, as low levels can also lead to agitation, but abnormally high levels can produce the same effect as well. Dilated pupils, dizziness, goosebumps, headache, or some other common symptoms. High levels of serotonin can also increase the blood pressure, and in some cases may cause a permanent condition known as pulmonary hypertension. Serotonin has been directly linked to the cause of certain types of hypertension. It is recommended to keep serotonin levels within a safe range. Some people may experience hypomania as a result of a serotonin increase beyond normal means. This may occur in individuals with bipolar II disorder, but others may experience it as well. This is characterized by significant talkativeness, socialization, euphoria, and risky behaviors, known as mania, which is an example also of excess speeding. In some people, mania may be triggered by high serotonin levels, while mania may be more likely to occur among those with bipolar disorder. Artificially elevated serotonin as a result of pharmaceuticals may also cause temporary mania. A rapid heart rate is also another symptom. Relaxation. For certain individuals, the relaxation response is enhanced by mild to moderate elevations in serotonin. This is what tends to reduce various types of anxiety and phobias. The serotonin elevation helps the person stay calm and remain relaxed in situations that would otherwise stress them out. Restlessness, shivering, sweating, and weight gain are also other symptoms associated with serotonin high levels.
More fatal symptoms include confusion. A serious symptom that may emerge is that of mental confusion. The person may struggle with memories, conversations, and may appear to be acting drugged. In some cases, high levels of serotonin are fatal and could end a person's life. Some people develop severe diarrhea from serotonin toxicity. This is a neurotransmitter that is found in the gastrointestinal tract and may be involved in digestive processes. Too much serotonin disrupts the gastrointestinal tract and can result in diarrhea. It is common to experience changes in blood and body temperature as a result of serotonin syndrome. Individuals might experience body shivers as well. It was already mentioned that you may experience an increased heart rate, but you may also experience an irregular heartbeat, which is problematic. An irregular heartbeat may put excess strain on heart functioning. Losing balance quite easily is also a symptom. Muscles may twitch excessively as a result of serotonin elevations. In extreme cases, some people respond to serotonin increases by having seizures. Some people may end up fainting or becoming unconscious if serotonin levels are too high. Some people end up feeling nauseous with flu-like symptoms that they end up vomiting. Lastly, feeling physically weakened is another symptom. Some ways of reducing serotonin includes activated charcoal, an obvious intervention for preventing high serotonin after ingesting too many antidepressant drugs or a combination of antidepressants. Certain dietary strategies can help reduce the amount of serotonin, including substances like gelatin and collagen are thought to help decrease the production and absorption of serotonin. A lower carbohydrate, higher protein diet should help reduce serotonin levels. There are several drugs that doctors will administer patients with abnormally high levels of serotonin. Most commonly administered are 5-HT2A antagonists, which help reverse the effects of serotonin toxicity. A couple of common used 5-HT2A antagonists that doctors prescribed for individuals with abnormally high serotonin includes cyroheptadine and chlorpromazine. Supplementing branched-chain amino acids can decrease serotonin levels. Individuals should consider supplementing L-tyrosine or a dopamine substance as it may counteract the effects of serotonin.
There are several conditions and situations in which a person may end up with abnormally high serotonin. The most common cause of high serotonin is from taking antidepressants. Mixing multiple antidepressants or exceeding the recommended dosage guidelines of the current medication may result in serotonin syndrome. Some people that use illicit drugs aren't aware of the fact that they could end up experiencing serotonin syndrome. This is a risk with certain stimulants, such as psychedelics and various opioids. While most people do not end up experiencing serotonin syndrome from a low dosage of illicit drugs, higher dosages and or interaction effects can produce high serotonin. After prolonged use of serotonin-based antidepressants, people can develop osteoporosis. This is due to the fact that when serotonin levels increase in the intestinal tract, it leads to bone loss. Overmethylation is a condition caused by polymorphism of a gene. Those that are overmethylators tend to create abnormally high levels of neurotransmitters such as serotonin. There is significant evidence to support the idea that high levels of serotonin can cause pulmonary hypertension. Serotonin elevations lead to constriction of the blood vessels and thickening of the heart valves. Long-term elevations of serotonin is a likely contributor to this condition. The most common condition associated with high serotonin is that of serotonin syndrome. This is a potentially fatal condition stemming from too much serotonin within the central nervous system. Serotonin syndrome can affect a person's cognitive function, coordination, and balance, and result in flu-like symptoms.
To recap a few things about serotonin, I would like to mention that serotonin functions by stabilizing mood. Having the correct amount of serotonin in the system is crucial for a balanced system. In the next video, I will be discussing the effects and conditions associated with a low serotonin level.